the cause of protein in urine?
Okay, she's asking what is the cause of protein in the urine and how to prevent it. We have said it before. It's like in our last lecture, we talked about urinalysis. Now, when there is protein in the urine, inner cause carrier in general public, inner cause is that there is an injury to the kidney. That is the commonest cause of protein in the urine. If you have urinary tract infection, we also have orthostatic proteinuria. Those are actually causes of protein in the urine. But this idea that by the time you eat too much protein, you have protein in the urine, it doesn't work that way. Unless when the liver is not working, it doesn't work that. But one of the commonest cause in pregnant women is preeclampsia. When the blood pressure is high, there is protein in the urine, and the leg may or may not be so swollen. But there is nothing you will do to prevent it. There is nothing. There is nothing. I don't know if you understand. But the only thing we can do is that we should avoid some nephrotoxic drugs. Like there are some drugs we don't give in pregnancy. We don't give gentamicin. Even before you take it, about everything that happens, I say gentam 80, gentam 480, most of those things are nephrotoxic. They can injure the kidney. You should avoid taking unnecessary painkiller. Any pain that you can walk through, don't take drug. It doesn't make sense. Now, if you're having a menstrual pain and you feel that this pain is not too bad and you can walk through it, then let it be. There are sometimes you might be having headache. The headache is coming from dehydration. Take water. It might be coming from stress. Sleep a little bit and wake up. The headache will disappear. It's not every headache that you take drug for. It's not every body pain that will take drug for. When you avoid those unduly taking of drug, those are the easiest way that we can avoid protein in the urine. As I said in the last lecture, sometimes pregnancy can make kidney disease worse, and pregnancy can also cause kidney disease. So when there is you see a kidney disease in pregnancy, you don't even know if it is the pregnancy that caused it or that it was there before. The pregnancy that makes it worse. So prevention of protein in the urine goes beyond the time you are actually pregnant. Before you take it, you must have started preventing it. How do you prevent it? Proper hydration, take enough water as much as possible. Then avoid unnecessary drugs, as I've been saying. About anytime you treat malaria, you get treat typhoid. It's not all the time you start taking omeprazole as no one else. Avoid nephrotoxin, avoid diclofenac, avoid ibuprofen. I'm not saying it's not a good. Those drugs are wonderful drugs, but we take it when necessary. Even water, there's a way you will take water, it becomes bad. What I'm saying that now, I myself as a doctor, I wrote ibuprofen, I wrote diclofenac when the time is right.